So you're affected this much and whatnot, and at this point you probably are like, something needs to happen, or you're gonna move on. Um, so when exactly did you start chemotherapy?
I started chemo uh, pretty much, I think it was a couple weeks after my initial diagnosis. I went into the hospital with severe chest pain. It was the worst pain I've ever had in my life. It was, see the veins in the back of your eyeballs kind of pain.
Okay.
Um, and, went into the hospital. At first, they couldn't pin it down. They actually they blamed it on everything from coffee
Hmm.
to a torn ligament because they couldn't figure out what it was. And then they took a few more X-rays and they figured out there was a mass behind my sternum.
Mm-hmm.
A couple weeks after that, that's when I started chemo. That's when the rough stuff started.
Okay. So how exactly does chemo work? Um, how does it actually attack the cancer?
Well, most, or I won't say most. I'll say a lot of chemos. Like I said, I'm not an expert in a lot of it in the medical field.
Mm-hmm.
Chemotherapy affects the quickly replicating cells in your body. Cells like short-term, mid-term memory, taste buds, liver, amongst other things. Um, and so those are chemo doesn't just attack the bad cells in the body. It attacks all of the cells of that kind,
Mm-hmm.
because cancer is a quickly replicating disease. What chemo does is attack every single quickly replicating cell in your body. Um, so,
Mm-hmm.
mhm.
Let some people, the viewers know, cancer is a type of protein in most cases, so it's hard to really pin down with chemotherapy. So the only way, like he was saying, is it only attacks fast replicating cells. It's hard to really judge cancer by itself, and it's really hard to make a medicine for it. So, um, anyways, moving on. Um, how did it feel to go through chemotherapy?
Oh my God, it was horrible. Um, I'm not really one to cry out to God, but oh my God, it was horrible. It was, I would say, bar none, the most miserable experience of my 35 years. Um, it's the doctors didn't really prepare me for that.
Mm-hmm.
Um, they kind of played it down a little bit. And they do that because you're scared. I understand that, but Jesus Christ, um, you're. I'm gonna put it to you this way: your bones are on fire. Um, it it feels like you're constantly chewing on tinfoil. Your mouth hurts. Your teeth hurt. Um, and your brain feels like it's stuffed up with cotton balls. Um,
Mm.
you feel dumb. Um, on top of the fact that you feel oily and greasy and you're constantly nauseous.
Yeah.
Um, so yeah, it was about hell times 10.
Sounds pretty bad. So I'm assuming at this point when you're in chemotherapy and you're feeling pretty bad, your emotions were probably all over the place. Um, how did it affect how you acted and stuff like that to other
Uh,
people?
during after the first round of chemotherapy, um, we talked about temperament before.
Mm-hmm.
Um, the My initial, at least psychologically and emotionally, my initial reaction was relief. Um, because, like I said, there'd been this, dark thing writing inside of me for, years, and now I finally knew why.
Mm-hmm.
So the temper actually went down. Um,
Okay.
the brain started to even out. Um, but emotionally, like I was distraught because I was dying. You
Mhm.
know, I did my best not to take it out on other people. Um, and I hear that I did an okay job, but I mean, I still felt like, kind of a whiny, mess. And, I still had kind of a short fuse because, um, this thing, I'm dying, and, that's all encompassing. You can't really understand it until you
Mhm.
go through something similar. Um, so yeah, it was like there was short fuse. I cried at the drop of a hat sometimes. Um, it was weird.
Oh, that sounds rough. Um, Going through all that, they had to prescribe you something to help you cope with your days. I know a lot of cancer patients actually get suggested to smoke marijuana or something of that sort. I'm sure you were one of the patients they suggested it to. Um, what did you do when they suggested that?
Well, first of all, we're gonna start with the medications that they prescribe you.
Okay.
Um, Now, those medications, these are super duper ultra mega anti-nausea medications. Now, if any of you have ever looked on the back of a bottle of medication for side effects, take those and amplify them. Um,
Mm.
these medications did their job, but quite often they made you feel worse otherwise. They made it to where it was pretty much damn near impossible to vomit, but you were wanting to the whole time.
Mhm.
Um, your, uh, headaches, diarrhea, constipation. Imagine that mixture. You know,
Sounds horrible.
yeah, you're peeing out your butt one minute, and the next day it's like a brick. It doesn't even come out. Um, so, on the subject of sleep and pain management, I actually live here in Texas. Marijuana is not a legal substance at this point, though I do hear that they prescribe THC and stuff like that in the hospitals. My doctor actually did not give me a prescription for these.
Mm.
However, um, in a rare act of, he stepped outside of himself. He informed me that, actually recommended, what did he call it? Alternative therapies,
Mhm.
um, alternative medications. He recommended that I find some, um, and but with one caveat: don't smoke it. Uh, the reason being is much of the marijuana and pot products nowadays, especially the stuff you get off the streets, has pesticides in it and fillers to keep it in brick form, and preservatives and stuff like that to
Mhm.
so that they can sell it. Um, and to the normal person, that it really doesn't affect you all that much. To someone on chemotherapy and quite possibly neutropenic, meaning their immune system is severely compromised, it can cause things like bronchitis and pneumonia.
Mhm.
Um, so what he suggested was the lozenges, the pot that comes in the form of a Jolly Rancher or a lollipop, even the hash oil, the stuff that comes in the e-cigarette cartridges. Um, Although in my experience with the hash oil, you got to watch out for some of those because a lot of those are flavored and scented.
Mhm.
Um, and we'll get into that in a bit, but that flavor and scent, it's quite often it's like lemongrass or something like that. That stuff hits you like a freight train when you're in this compromised state.